Hi,
Yes,
this
it
is
is.
Sunant. This is Sunant.
How you doing?
How are you? I'm doing fine.
I'm okay. We
Okay.
got to.
I'm really sorry for the delay because we had some technical issues here.
Oh, that's all right. Things happen.
Okay. No problem. So, can we get right ahead with this? Do you have any questions for me?
No, let's go ahead and go.
Okay. So the thing is, my manager was going through your profile and she was really impressed with your work. And
Thank you.
so I went through the blogs that you've written, and they're really, really great. So I thought, it's very good if we could connect and, get to know about your experiences in the field and, understand what you do and write a blog post. So let me tell you about what I do. I'm a content writer here, and I write blogs for the company, blogs. And we write about digital marketing, and any kind of industry verticals, and what digital marketing can do for clients across the world. So my specialization is basically digital marketing and how it can help marketers improve their marketing. So since you are in the healthcare business, it's really a very big booming business all across the world, and digital is getting strong there. So me and my manager, we thought we could just get some insights from industry veterans like you, and write a short blog post about what you have to say about it, featuring your name, and just go ahead with that. So that's the reason we are here. Yeah.
Okay. Well, thank you very much, and I'm honored. I really am.
Yes. So let me just start off with a small and very basic question. What are the common challenges that you face as a healthcare marketer?
I wish there was a simple answer.
Yes.
Well, I mean, healthcare marketing is a challenge all around the world. I
Yes.
don't think there's any question about that.
Yeah.
It's the challenge today of healthcare marketing, and I think to understand is that most healthcare marketers, and I'm assuming we're talking about people that are working in hospitals and health systems and marketing physicians.
Okay.
We're not necessarily talking about B2B.
Okay. Yeah.
But if you look at what's happening and what's going on with hospitals and health systems, most of their marketing has been more of a marketing communications effort over the years.
Yeah. Okay.
It was more about running ads and doing newsletters and doing stuff and not truly doing marketing.
Yep, that's true.
So the challenge that they're facing today as markets change, as individuals pay more out of pocket, as the government expects people to be more involved in their care and making choices and being aware, you have the healthcare industry is moving from we'll take care of you and do things to you, don't you even worry about it, to I'm paying more of the bill now, so I have a say in what's going on. Yeah. And now that, like in the United States, now that I have a requirement that I have to buy my own health insurance, well, guess what? That's out of my pocket. And when people are buying health insurance, they exhibit consumeristic behaviors.
Definitely.
So essentially the challenge is that it's moving from what I would call a provider-dominated market to becoming a consumer-centric semi-retail market, which is very different. So in the end of the day, what that really means is that healthcare marketers are going to have to be more consumer-friendly and do more consumer types of marketing and research than what they've done in the past because of the choices that are available and people demanding a say in what's going on because they're paying more.
Yep, that's true.
Does that make sense to you?
Yes, definitely.
So it's a dynamic market shift that they're not ready for.
Yeah, this happens everywhere. Since we're seeing digital marketing getting stronger, the traditional marketing methods are not really helping as much as they would. So the budget spends are increasing, and for digital and social media marketing and all of these things. That's because the consumer is more connected. And he wants to know more. Yeah.
Exactly, because there was an infographic I saw a while ago, and I think it's like 41% of people when they're searching for a healthcare provider will use the internet, will use social media to help them make a choice.
That's a big number.
So, and that's adults. I mean, people that, there's a tendency sometimes for marketers to think, social media, that's the kids. No, 41%, the number of adults that are on that with mobile and with digital and with the smartphones, and they're going to websites, they're using Twitter, they're on Instagram, Google Plus. I mean, they're looking for healthcare providers to find out what do they have out there, what do they have to say, who's saying what about them. And most hospitals and health systems have a digital presence, but it's not anywhere near consumer friendly.
Yep, that is true.
Some places will, but that's the exception to the rule. Most of their hospitals' website in the U.S., most of them aren't even optimized for mobile.
Okay, that's cool. That's true. Okay, that's about the challenges, and how do you think you have overcome these challenges? Because I know that you're an industry veteran. You've been in the industry for a lot of years, and you have seen the shift happening. Right? You have done traditional marketing, which is newspaper ads and TV ads, and then you progressed towards digital. So your suggestion would be to invest a little more into digital and more of customer-centric conversations rather than,
absolutely.
Yeah,
absolutely. And it's more about experience now and price than it is really a lot of other things. The convenience, access. It's about the consumer. It's not about the hospital or the health system or the doctor anymore. And marketers really can the only way that marketers are going to be able to overcome these challenges is that they have to increase their knowledge base. I learn constantly. I look at other industries to see what's going on and what's working and how can I apply that to healthcare. I'm constantly on webinars with the American Marketing Association or reading books, just reading articles, and plus, too, using Twitter myself very heavily, using Google+, using Facebook, using all of these tools that are out there so that I can figure out how they work within a hospital or health system or how they could be used. And marketers have to do that. They have to increase their knowledge. They have to look at other industries, and they have to be creative in how they want to use things.
Okay, that's great. Okay. So moving on to the next question. You know that data is a very important part of marketing right now.
Yes.
So how do you think healthcare marketers can use big data ethically? Using data is a little bit of a gray area. There are a lot of issues when it comes to handling big data and things like that. So how do you think you can use it ethically? Have you been using data in any way?
Oh yeah, I use data all the time.
Okay.
And I recommend that hospitals and health systems use data all the time.
Okay.
And right away everybody raises a hand in the United States and goes, oh, it's HIPAA, it's protected. As long as you're not releasing protected health information or using protected health information, you're fine. There's nothing that says that you can't go into a hospital's database, and do an analysis to go, I'm going to look at this particular service area. Okay, I want to know how many admissions. Now that's a global. How many admissions or how many outpatient procedures did I have for heart failure? For CHF.
Okay.
Well, you can look at that to see what's going on. Then you can go to the Centers for Disease Control, CDC, here in the U.S. And go, okay, what are the CDC use rates for heart failure in this service area? So that you can match the two, and now you can figure out that, I have a higher than normal incidence, or you can figure out from the use rates of CDC applied to that market area that you're looking at, what is the incidence of heart failure in this community. Now, there's nothing there that says anything about protected health information. That's global data, and you're using those sources, which means that now you may take the next step going, I have a higher incidence of heart failure in this area. I need to market that, or I need to put a physician's office in there, or I need to do other things for the community. Maybe it's running health and wellness programs. Maybe it's doing something special. But that's how you can use data. Now, nowhere in this discussion or that analysis that I looked at protected health information.
That's very good. That's excellent. That was a very beautiful example, Michael.
So that's how you can. But that's how you can use data. And there's nothing that says you can't use data. You just can't use protected health information. I can't say, I know these 20 people that live on this block that had this disease, so I'm going to send them information. That you can't do.
That you can't do. Exactly. Yeah. That is very true. Okay. So coming next, we have another question, which is about in healthcare. It is always seen that the brands become bigger than the cause, where the hospitals or the pharmaceutical companies, they overtake the cause and they become bigger than the cause. So what is your take on that?
Yeah, that's pretty much it. But the cause is healthcare, and the cause is taking care of people, and they've never left that. I mean, people. I mean, I know I worked in hospitals and health systems. I mean, people get into that business because they care, because they want to do good. I mean, they're not in it. You're not going to get rich getting into healthcare. I mean, that's not the whole thing. It's about mission, and it's about the value that you bring to help people. And I think that underlies that's always there. I think what happens is that a health system brand or a hospital brand or even an independent physician's brand, if they're a noted researcher or clinician or surgeon, whoever they are, they start to believe their own clips. They start to believe what everybody says, how great they are, or the things that they do. And that's the situation when the brand becomes bigger than the cause, because they forget what their roots were. They forget where they're going and what they're doing. What I'm seeing now, as the healthcare markets change, brand is critically important. But what healthcare marketers are finally starting to do is understanding what is the value proposition of the hospital or the doctor or the health system brand or the group practice brand. How does that meet the needs of the community? How does that meet the needs of their patients? What value are they delivering? And they're focusing on how do I increase the awareness of my brand, say it's Advocate Healthcare, just as an example, or a Mayo Clinic or the Cleveland Clinic, and what does that bring so that they're moving away from this, wow, we're great because we're the Cleveland Clinic, to, and here's how the Cleveland Clinic though brings you value, and all of healthcare is migrating to that. And I think that's a stronger definition of the brand and a better connection of the brand to the original mission, if that makes any sense.
Yes, definitely. Okay. I have one more question, which is got to do with the regional marketing. So how important is regional marketing in healthcare? Do you use a blanket approach to a particular area, or do you have, you use data and then you get into the roots of the area and, create a plan just for a particular area and then go ahead with your marketing? Is that how you work?
That's how you have to work. That's not necessarily what happens. But, because they're trying, sometimes it's the lowest common denominator, but, people just kind of like throw things out there, and what they really need to be doing is looking at the service area, understanding what the incidence of disease is, where that disease is it chronic, is it acute, is it inpatient based, is it outpatient based, because it's evolving. I mean, healthcare is evolving from a marketer just doing a lot of stuff because, we're paid for the production of care, meaning I need to put heads in the beds. Because the more things I do, the more we get paid. And even though it's a tough market to be in, because on one side, you have to be doing that. You've got to work with your doctors to put heads in the beds. And the other side is that there are some people out there that you have to manage the demand. So, and as healthcare gets turned upside down, the hospital is the last place anybody wants to be or go. That's the most expensive setting. So healthcare marketers now will be doing a number of things. They'll be generating demand, but more importantly, as the future goes forward, they will be managing demand. And the person getting a service within a healthcare network, it may not be in a hospital or hospital-based outpatient service. It could be a separate ambulatory surgical center. It could be a radiology diagnostic center. It could be any number of things that will not generate revenue for the system, but under a capitated risk-sharing agreement, will save system. It gets back to the IHI triple aim, right care, right place, right time, right cost kind of thing. And that's what's going to have to happen. But healthcare is local. It always will be. Now, there will be some shaking out in the markets. You don't need all these hospitals we have here. They'll be, I think for the future, hospitals will be smaller. They'll be far more specialized. And, you know, they're going to be at the bottom of the food chain.
That's exactly my point, because the thing is, healthcare is not really a global thing, you know. You cannot look at it in a very broader perspective. You need to be really drilled down, and you need to find out what a particular region, you know, the issues are. And then if you, you know, project your brand and your solutions to that particular area, you have a better ROI. That's exactly what my point is.
Yes, exactly right. You're exactly right.
Okay. Coming ahead, there's just one last question I have for you. You work with a lot of hospitals, right? So do you have any specific thoughts about patient and consumer experience management?
Oh, yeah, I do.
Okay.
I do.
Just give me a ballpark idea.
No, that's all right. It's just hospitals and health systems experience is everything now.
Yes.
But if the experience is not from the viewpoint of the hospital or health system, the experience is from the viewpoint of the patient or the healthcare consumer, which means it's not isolated. It's not just about, you know, coming in and admitting or getting into radiology. The consumer experience is about managing that every touch point from the very first time they find out about you, whether that's seeing your website or direct mail, to when they're done. And the other thing to remember about this is that an individual is only a patient 1/3 of the time in their encounter with you. And that is when they're getting treatment or diagnostic services. Prior to that and post that, they're a healthcare consumer. So those touch points are just as important. And what's happening is that hospitals and health systems do not look at the totality of the experience. They take one little thing, which has a minor impact, but still, you know, they don't look at it. They don't look at globally. They don't look at the experience globally. They don't look at it in the totality, and that's how you have to manage the consumer experience. Does that make sense?
Yes, it is very interesting. It's very interesting. Okay, one last question, if you don't mind.
No, that's okay.
Okay, what is the role of social media and digital marketing in hospital marketing?
Oh, I think that's critical. I mean, social media is how you're going to be able to engage patients and how you're going to engage health. It's all about engagement. It's not about just throwing stuff out there, but social media is how to reach out and touch someone personally, how to engage them personally. And hospitals and health systems do a very, very poor job of engaging patients.
Yes, it is. It is very true. We don't find a lot of hospitals and brands, you know, on social media.
No, and it's all about engagement. I mean, you know, it's especially as they build, you know, risk and capitated networks, especially as they build closed systems. You know, if I'm going outside of the system, well, you know what? I'm losing that revenue, or it's costing me more money. For example, myself, just as you and I are talking, I was a patient for what turned out to be not a heart attack, which was really cool. But from the time, and I've been to this hospital before because that's where I have my insurance. I've never gotten any. Never. I've used that. I've used their ER. I've been in that for 23 hours. My kids have been there. My wife. I have never gotten anything from them to engage me on any level. Nothing. And I'm like, really? You know.
Too bad.
I mean, it's just like, don't you think you should be talking to me? Don't you think? You know what I mean?
Yes,
I mean, just waiting for me to show up? Okay, great. Well, you know, see you someday.
They're just waiting for you to fall sick and just show up, you know. That's not the way to do it,
No, there's absolutely zero engagement at all, and they have to. Their Facebook page sucks, their website sucks, their advertising, and it just does. I mean, I'm being honest with you about it. You know, I'm not going to name them because I don't want to get sued. But at the end of the day, you have to engage me as the person. You have to, you know, it's just like that, and that's kind of like what we talked about earlier about the arrogance of the brand. Well, just because you're this XYZ hospital, you know, I do have a choice. Now, I do choose to come here because it costs me less money because I'm in network. But at the end of the day, it's just, you know, at the end of the day, it's just, you have to engage, and you have to do that with social media. Yeah. You know, you have to send, you know, you can use text. I like text messaging. Mm. You know, that's fine. You know, get my permission. Figure it out what you want to tell me.
Yeah.
You know, here's an example, like Foursquare.
Okay.
You know, the location service.
Yeah.
Now, and I've written about this in my blog, but I go to Chili's. You know, family will go out to dinner.
Yeah.
You know, and I check in at Chili's. Oh, and you know what? Next thing you know, I got a message on Twitter from Chili's. What looks good on the menu?
Oh.
And then I respond. I go, well, I'm going to have this. That's great, Michael. Let us know how you liked it. I realize this is all automated, but think about the power of that going, you know what? I just checked into a hospital. Well, is it me checking in, or am I there to visit somebody? Okay. You know, and engage me at that level. I mean, I'm not expecting a coupon or anything, but Chili's, when I check in on Foursquare, gives me a code for a free appetizer.
That's awesome.
It's a restaurant; they'll do that. But it's an exciting use of social media and how you use Foursquare, which is a location, to engage me in a dialogue and a conversation. Why aren't hospitals doing that? Why aren't healthcare providers doing that?
Okay, that's an awesome question. Yep.
Okay, I'm awesome. Sorry.
That's very nice. That's very nice, Michael. So I've come to the end of the conversation. I've finished off whatever I need. I've got a lot of information from you, and what I'll do is I'll go ahead. I'll write a blog post, and I'll include your profile and a summary about what you do, and then chart out this entire conversation and the questions that I've asked you and the answers that you've given. So I'll take.
Thank you very much.
Yes, I'll take about a week to get done with this, and once I'm done with it, I'll send it across to you so you can go through it and just let me know your thoughts on it.
Okay, well, thank you so much, and I really appreciate this, and thanks for your time. And, any other questions come up, just shoot me an email.
Okay, thank you very much, Michael. It was a pleasure talking to you.
All right, take care.
Yeah, bye.
Bye-bye.